Namaskar, Sat Shri Akal, Adab. Good morning, good afternoon, and good evening to all of you. Thank you for joining our live session. My name is Kunjan Mawar. I'm your host and those for today's live session. New feature, eGlobal Doctors Digital Health Hospital is coming up with new project called eGlobal Ayush. The project is for Indian folks working in USA, UK, Australia, and Europe. Do you worry about the parents who are back in India? Well, eGlobal Ayush packages will help you provide medical services needs for NRI parents in India. For more information, please make sure you do visit eGlobalDoctors.com. eGlobalDoctors Digital Health Hospital, connecting patients across the globe to all doctors all over the world. In today's live session, we will be exploring and providing more information about cancer care in conversation with Dr. Dodul Mondal. Dr. Dodul, his specialities include oncologist, radiation oncologist, comprehensive cancer care, clinical oncology, cancer screening, genetic screening, cancer diagnosis, and treatment. Dr. Dodul is a contributed author of multiple national and international textbooks. It's really nice to meet you virtually. Thank you for sparing time. How are you doing this morning, doctor?
I'm great, Kunjan, and thank you so much for inviting in this beautiful program.
Thank you. It's pleasure is always ours. I know you, when you come, you bring the wealth of knowledge and we are looking forward to it. So without any further, should we dive into today's topic, doctor?
Yeah, sure.
Thank you. So if you are joining, we are live to you and we are live on Facebook, YouTube, Twitter, LinkedIn, and Instagram. So hop on your social media and where we bring interesting and topics for you. So today's topic is cancer care. So what is oncology, doctor? And what types of disease does it address?
So very interesting question to begin with. Oncology means a specialty in medical sciences, which typically deals with patients having a disease known as cancer or a tumor. So it may be a malignant cancer, which commonly we call as cancer, or it may be a benign tumor. It may not be a cancer, but oncologists deal with both of them most of the time. And as I said, it deals with cancer and tumor. So it can deal with any tumor, any lump, any growth, any cancer, starting from head to toe. And we should not forget about something known as blood cancer as well, because they are not usually forming any kind of lump outside. But yes, that's also one type of cancer which oncologists deal with.
Okay, thank you for that wonderful introduction. So we know what is oncology and what are the diseases it's addressing. Now, my next obvious question is, what is an oncologist and what is it that they do?
So an oncologist is essentially a doctor trained in this field of oncology, when he spends extra few years after passing from the med school, doing some kind of specialization either in the field of medicine or surgery, and then entering into the field of oncology when they do kind of super specialization, you can say. So an oncologist can be divided into radiation oncologist, where the person treats cancer with high dose therapeutic radiation. He or she can be a surgical oncologist, where they typically try to remove the tumor by surgical operation, and medical oncologists who deal with cancer by treating cancer with some chemotherapy or some kind of medicines or injections. We call them systemic therapy. Now, new generation doctors must be knowing about something which call as palliative care expert. They are not traditionally that way oncologists, but of course they are essentially part of an oncology team. So broadly, you can say that surgeon, radiation oncologist, medical oncologist, or chemotherapy expert, and palliative care expert. So they typically form a group of oncologists.
Okay, perfect. Thank you so much. At least now I know when I see one who is an oncologist. So thank you for that.
Oh, yeah,
so
sure.
Tell me, what is the need? Like, why should we discuss about cancer?
That's a very nice question. When we need to discuss why we need to discuss.
Mhm.
So we need to know what is the problem, how big is the problem, and why are you discussing this. So if you see globally, few things or few diseases, they are consistently and constantly rising, and definitely cancer is one of them. Now, at this moment, if you see, almost 20 million people are suffering from cancer worldwide, and that number has gradually going up, right? Now, another important statistics is almost half of these 20 million, that means uh, almost 10 million people are dying every year from the cancer worldwide. So almost 20 million people are being diagnosed and almost half of them are dying. So that's a big problem, huge problem. And it's not a problem which is going to reduce with time. Rather, it's a problem which is going to increase over the period of time. So we need to discuss and we need to find out solutions.
Okay. That is a scary number. Almost half of them, the survival rate is actually half of the people who have been diagnosed.
So
So,
I'll just interrupt. It's not exactly that. I mean, it's a statistical jargon. It's like overall, if we see over last 2 decades, survival in cancer patients have dramatically increased. And overall, you can say like almost 65 to 70% of the patients, they survive. If we look into the data of childhood cancers, then the survival rate even more promising, almost 85 to 90% of the childhood cancers patients, they now get cured. So it's not like that. Again, the survival depends on the stage of the cancer and the way they were treated. But when we say 50%, that probably takes into account a large number of population at one point of time. So at one point of time, there might be 20 million people suffering from cancer, and you can expect that 10 million people will be dying in next 1 year. Maybe some of them were diagnosed 10 years or 20 years back. Right.
oh, understood. Yeah. So thank you for putting that positive twist. It actually makes me feel much better now.
Yes.
Yes, and I hope I don't have to go through it or I don't have to meet you in these circumstances. But if I ever do, I know I'm in safe hands. So thank you so much for that. So
You're most
you
welcome.
touched upon, thank you. So you touched upon cancer. So I'm going to talk like what are different types of cancers and how are they classified?
So typically we classify them into, let us start from the tumors. So that will make things easier. So tumors can be of 2 different types. One, we call them benign tumor, which are non-cancerous, and then malignant tumors, which we call them cancer. Now, usually we do not discuss about the benign tumors because most of them are not life-threatening and they are mostly easily manageable. Now, the cancerous ones, again, they are divided according to their tissue or cell of origin. So the one originating from the epithelial cell or the lining of some lumen or some organ, they are known as carcinoma. The one which is originating from the mesenchymal cells like muscles, tendons, cartilages. So basically the structures or organs in our body which helps in connecting one organ with another or sustains our body. So muscle, bone, cartilage, tendons, right? So they are known as sarcomas. So carcinoma and sarcoma, they are divided into 2 broad categories. And as I said earlier, we should not forget about the liquid malignancies or liquid cancers, like the blood cancers. Now again, all these cancers can be divided into according to their organ of origin, like brain tumor, like head and neck cancer, like lung cancer, gastrointestinal cancer, like breast cancer, prostate cancer, like that. Again, all these individual organ-based cancers can be subdivided according to their pathological type. Say, for example, we know about lung cancer, and lung cancer again can be divided into non-small cell lung cancer, small cell lung cancer, with many more subspecification into each of them. So I think that will be too much of a technical discussion for this session.
Okay, but it does help. So we know at least for the beginners, we know there are different kinds of cancer, and this is how you classify them. So I just have a follow-up question. You mentioned benign cancer. We don't have to talk about it, but can a benign cancer or benign tumor, whatever the right term is, can it ever become active cancer?
Yeah, there is some possibility. Some benign cancers can turn into a malignant one over a period of years. So when we detect a benign tumor, although we say to the patient that, yes, you don't need to worry about that, but at the same time, we add one more sentence, keep following up. That means there will be certain clinical features or symptoms based on which we might suspect that this is probably transforming to a cancerous one. The best and commonest example I can give you is a fat tumor. Many of us have some small fat tumors under the skin. We call them lipoma. Now they're very common, so common that if you just ask 100 people, probably 5-10 will say, oh, yes, I have some soft fat tumor in my body. And the risk of transformation of this very benign fat tumor into a malignant was is probably less than 1% over a lifetime period. But still that percentage exists. So we explain that we know it's a benign tumor, it's not going to kill you, but at the same time, you need to monitor certain things like if it is increasing all of a sudden in size, or are you experiencing some kind of severe pain into it, then you must come to the hospital to check whether it's turning into a cancer or not.
Okay.
And probably that's applicable to many of these benign tumors.
Okay, perfect. Thank you for that clarification. So hopefully if somebody is listening and they know that they have a benign tumor or benign cancer, please don't worry about it. We have experts, so obviously go and talk to your experts. So now that we know a little bit about cancer and their classification, my next question to you is, what are the cancers which can be screened?
That's a very good question. So before answering this question, we need to know what is screening. So screening is a method of detecting some abnormality, and for us, it's a cancer. So I'll specifically discuss about cancer. So screening of cancer means identifying some cancerous tumor even before they are clinically apparent, or even before they they create any kind of symptoms to the patient. That means it's an absolutely normal human being who doesn't have any problem came to the hospital or healthcare system to know whether they have some kind of tumor or cancer in their body, and we do certain tests to identify if they really have that kind of cancer or not. Now, theoretically, probably we can try to screen each and every cancer, but then that will employ thousands of unnecessary tests. So there are certain guidelines which have internationally been accepted that certain cancers probably merit being detected at a very earlier stage, because the investigation is easy. Detecting them early makes it meaningful because you have a treatment to offer, and treating them at an early stage again makes it meaningful because that makes a significant difference in final outcome. So most common cancer which you want to screen worldwide is breast cancer. It's a very simple test we call mammogram, which in individual countries, they have different guidelines to regarding at what age you should do that test. Then that very simple mammogram can actually detect a very small tumor inside breast in an otherwise normal woman. And if you treat them properly, the success rate or cure rate is more than 95% or almost 100%. So that's definitely important. The second common cancer which we try to screen is prostate cancer, which is mostly a cancer in old age. And once upon a time, it used to be said that prostate cancer is a cancer of affluent society. But nowadays, we are seeing that cancer becoming more common across the socioeconomic status, across the globe. So low economic countries, high economic countries, everyone is now having more prostate cancers. Again, that can be detected with a very simple test known as a simple blood test known as serum PSA, prostate specific antigen. It's a marker for prostate cancer. And beyond a certain limit of this marker, we investigate the patient whether they have that cancer or not. Now, a few other cancers which we try to screen, they include lung cancer, where we use a very low dose CT scan, colon cancer or rectal cancer, which can be screened by doing a colonoscopy, and in low income group countries like ours and some African countries where cervical cancer is very, very common. It's a cancer of the woman, which can be detected by a simple test known as Pap stain or cervical cytology. So these are a few very common cancers which can be screened, can be detected at a very early stage, and when detected and treated at that stage, gives you a very, very high cure rate.
Thank you for that wonderful information. We do have a question on our live, so I'm going to be, and it's very befitting with the topic that you're talking about. So the question is, can I do screening of cancer at home?
Of course, very interesting question. But the simple answer is one should not try to attempt this at home. All this screening and interpretation of these tests are very complicated, and it needs properly trained person. So to do a mammogram, you need to have a properly trained radiologist or a nurse dedicatedly trained for this purpose. In our country, we do not have that robust facility as of now. So in our country, most of the time the diagnosis happens by the radiologists. Low dose CT scan needs a dedicated specialized CT protocol for this particular purpose. Detection of serum PSA needs a lab. Pap stain again needs taking the sample, which can be done only by a trained personnel. And of course, colonoscopy, it's an intervention which needs a proper radiologist. So no one should actually attempt these things to be done at home, because if things go wrong, it can be life-threatening as well.
Thank you for that answer. So hopefully whoever asked this question, you know the answer. Please, the answer is no, and don't try to be a doctor. We have subject matter expert for a reason. So go to them and they will help you take a decision for you.
So thanks, Kunjan, for using this specific sentence, don't try to be a doctor. I appreciate it.
I know. I have, sometimes I become a doctor and then I Google stuff and then it gives me more headache. So I leave that to, the subject matter experts like you. So yes, don't try to be a doctor. So we were talking about cancer and the screening. Let's talk about this. Is cancer preventable? Can it be prevented?
Oh, yeah. I'd love to say that cancer is preventable. It's probably one of the commonest disease which can be prevented. So again, if you see the statistics, almost 60% cancers happen because of lifestyle related things like smoking, alcohol, exposure to pollution. So using some tobacco, like in India, using tobacco is very common. It comes in different forms, and there are a lot of celebrities who are promoting these stuffs on different media, including video, audio, or print media. So young people easily get influenced by their so-called heroes or the sheroes, you can say, and they start using those stuff. So our statistics say that almost 60% of our cancer burden are because of all these things, mainly smoking, alcohol, and tobacco. So if you cut down these things, you are actually preventing almost 60% cancer. Now, a few other cancers are considered as effect of lifestyle, although we are not very sure. Like breast cancer, colon cancer, they are partly being related to diet, sedentary lifestyle. So probably if someone becomes more active, be on a balanced diet rather than on a high calorie, high fat diet, they can reduce their cancer risk. Certain food, of course, it's very difficult to comment that way, but there are certain food which come with added preservative. Now that particular food may not be the culprit, but the chemical agent being used to preserve the food may cause cancer, like some canned food, tin food, So again, if you are reducing consuming those things, you are actually preventing the risk of cancer. There are certain ways also, like vaccine. I'll mention about two particular cancers. One is cervical cancer, which is very common in many parts of this world. And many developed countries actually have in the vaccination program routinely, and they have shown that by implementing cervical cancer vaccine proper age and in a proper manner, it has reduced the cancer burden, cervical cancer burden, by more than 95%. The second cancer I'll be mentioning about is liver cancer or hepatocellular cancer, which has been related to one of two viruses. One is hepatitis B and the other one is hepatitis C. Now we have a vaccine against hepatitis B virus, and in many countries, hepatitis B vaccination comes as a routine vaccination campaign as part of the national immunization program. So getting vaccinated against hepatitis B virus, of course, gives prevention against developing hepatic cancer arising out of hepatitis B virus. Now, it's also important to understand that when I say hepatitis B-induced virus cancer, there are other factors also behind developing hepatic cancer or liver cancer. So there are countries like in our country, in India, it has been seen that most of the liver cancers are actually not because of hepatitis B virus, but they are because of fat, a non-alcoholic steatohepatitis. That means it's not related to virus, it's not related to alcohol, but it's because of more fat accumulation in the liver, which gradually damages the liver, leading to cancer. So probably a lifestyle change, dietary change is much more important for that.
Okay, so I like the answer. Yes, it's very much preventable. Make sure that you follow what doctor was telling us. So I love when we get the engagement. So I have another question that's coming from our live doctor for you. And the question is, what are some symptoms of cancer that one should look out for?
Well, a very good and common question. Anything or any symptom can be because of a cancer. So cancer can cause any possible symptoms, and any possible symptoms in the body can be because of a cancer, but that should not scare someone. There are some common symptoms we always talk about, like the most common symptom is a lump. So a lump anywhere in the body should be taken seriously. The common people may not be able to differentiate whether it's a cancerous lump or non-cancerous. So he or she should go to a health facility. Bleeding from any side. Often we keep on hearing that I have been having bleeding from my rectum for a long time and it's because of the piles. So many of these patients can have a rectal cancer or colon cancer rather than actually piles. So bleeding from any side, a lump anywhere in the body. We know about moles on nevus. Many people consider them as birthmark. Now, a sudden change in the color or size or shape of that nevus or mole can indicate that the benign thing is transforming into cancer. A cough, which is not healing for 2 weeks, like someone is coughing for 3 weeks, 4 weeks, and in low economic countries, most of the time, people consider them as part of tuberculosis, and unnecessarily the patients are put on some antitubercular medication. So many of them can have lung cancer, and we need to investigate them. A sudden change in bowel habit, like constipation and diarrhea, or sometimes someone is having constipation, sometimes someone is having diarrhea. That can be because of rectal cancer. And ulcer in the body, like a chronic ulcer on the skin. Many times we see ulcer over foot or toe or over the ankle. So that should be investigated. So these are very common symptoms, and you can easily find all these symptoms mentioned in the website of WHO. So they're classical symptoms for cancer. Now, one different category of cancer we are discussing was blood cancer. So they may not be presented with any of these symptoms, and they can just come with some kind kind of unexplained fever, unexplained weight loss, some glands here and there, some breaking spots on the skin, sudden swelling of the abdomen because of the large size of spleen or liver. So this should again be investigated already.
Okay, perfect. So whoever asked that question, I hope you got how you can screen. Look out for all the abnormalities that the doctor just mentioned. So I just want to tell our listeners, our viewers, that we are live on Facebook, YouTube, Twitter, LinkedIn, and Instagram. So hop on your social media. I know some of you are already here because we are buzzing with questions, and keep the question coming. That's what makes our session interesting. So if you are looking for an second opinion for cancer treatment, eGlobalDoctors Digital Health Hospital provides you with a platform to access top oncologists from access the world with consultation pricing starting $199 only. So I'm going to go to my next question, doctor. What is interventional radiology and how does it help in cancer treatment?
Wow, that's a great question. I mean, I must say that this is the first time in such an awareness program I'm hearing this question. So, interventional radiology is a branch or a specialty where radiologist comes to play in illness, and that starts from the point of diagnosis. So, a lung seen inside the body where one cannot access easily to get some tissues or cells, we see the help of interventional radiologists, like getting a tissue, either FNAC or biopsy from the lung or abdomen, or a difficult location inside the neck, or that for that matter, any part of the body. So they take help of ultrasound or CT scan or sometimes PET CT scans to look at the tumor, enter the middle, take out some tissues, and help us in the diagnosis. So it starts from diagnosis. Secondly, many times we need to administer certain drugs inside the tumor. The best example I'll give you is liver cancer. We call it transarterial chemoembolization or transarterial radioembolization. So either a small dose of chemotherapeutic medicine with some glue or radioactive material is instilled inside the tumor. Now you cannot easily access the liver. How can you access? So the interventional radiologist goes through some artery in the body. Mostly they access it to the thigh artery, and the needle or the catheter goes directly inside the tumor and instills the medicine. So that is one of the other examples where the interventional radiologists help us. Third is occasionally some tumor can bleed. Say for example, there is a lung tumor and the person started having bleeding. We call it hemolysis. So the interventional radiologist do an angiogram. That means they try to see the entire muscular system of the lung and try to identify the source of the bleeding. They can by introducing some catheter, they either coil it or put some glue material so that the bleeding vessel stops. So that's few of the instances that the interventional radiologists have a big role to play in oncology. Other than that, although it's not directly related to cancer, probably many of you have heard about arteriovenous malformation or AVM. So it's an anomaly inside brain when the person can have bleeding inside brain leading to paralysis or even death. So a neurointervention radiologist come to play in that situation. So they can go through the artery, coil or clip that bleeding vessel and stop the bleeding. So in today's time, intervention radiologists have a big role to play in oncology department.
That's amazing, and it does sound a little scary. So, but thank you for
if you have a department with properly trained, skilled intervention radiologists, they are actually the room and a key person in saving many lives.
Yes. It looks like it. They are absolutely critical part. So thank you for doing the portion. So when we were talking earlier, you mentioned two terms. One was radiation, and of course, chemotherapy comes with cancer. We have heard this name. So, are these two different, radiation and chemotherapy, or if you can shed some light on that?
Yes, of course. So, radiation and chemotherapy are, of course, different things. So, many of us are actually aware about the radiation thing, but we do not understand that this is the same radiation used for cancer treatment. I believe there will be hardly anyone who has never heard about X-ray or CT scan. So, all of us know that X-ray and CT scan, and that investigation uses X-ray. So, it's the same X-ray most of the time we use for cancer treatment. Of course, the X-ray which we use for cancer treatment is million times higher in energy compared to that X-ray which is being used for a diagnostic purpose or CT scan. So that high energy X-ray has the ability to penetrate through the body, getting concentrated inside the tumor tissues, damaging the DNA of the tumor cells, and by doing that, destroying the tumor. Of course, it comes with many fancy machines which give us the ability to shape the high dose radiation within and around the tumor and essentially shape the surrounding normal tissues. So that's the principle of radiation in cancer treatment. You hit the tumor as hard as is possible without hitting the normal cells. So kill the tumor cells and save the normal cells. Right? Now, in essence, chemotherapy is completely different. So it's a medical substance. Mostly we call them cytotoxic drugs. So they are either some injections or some tablets or capsules in nowadays, which are either being given by some intravenous fluid, or patients can take them orally as well. So they are essentially medicines. Once it is inside the medicine, inside the body, it circulates by the blood. And it reaches the tumor cells. They have some specific mechanism of action by which they get concentrated inside the tumor cells and less concentrated in the normal cells. So when they are concentrated in the tumor cells, again, they actually damage the tumor DNA. Essentially, gives tumor control. The basic difference between radiation and chemotherapy is the effect of radiation is local. That means the effect, side effect, and everything because of radiation will be very, very local while we are trying to concentrate it. The chemotherapy, on the other hand, is a systemic treatment because it circulates by the blood. So, other than showing local tumor effect, sometimes it can also show some kind of systemic side effects as well. So that's the basic difference between the two things. Radiation, to some extent, you can compare with the surgery, like the surgeon operates and takes out the tumor. So it's a local thing. Where the tumor is, the surgeon takes it out. So radiation is also a local treatment. Wherever the tumor is, we try to concentrate and focus there, sparing other parts of the body.
So radiation is basically concentration where the cancer or tumor is.
Yes.
But chemo goes everywhere, and we hope that it targets the cancer portion through the blood. Okay, perfect. So we talked about radiation and chemotherapy. Let's talk about the side effects. Are there any side effects of both treatments?
Of course. There is no treatment on our available which gives you only effect without side effect. So all medicines, all treatments do come with some side effects. Like radiation can have some local side effect in and around the area of radiation. Mostly we call them some burning effect on the skin. And these side effects are gradually become lesser and lesser with advancement of technology. So the common side effects with radiation are like fatigue, some nausea, which are mostly unexplained. Depending on the area of radiation, someone can experience local mucositis or ulcers inside mouth in case we are giving radiation to renal region. Some kind of headache when we are giving radiation to brain. Some dry cough when you are giving radiation in around chest, or some difficulties in swallowing in case we are trying to target the food by some nausea or diarrhea or vomiting when we give radiation to abdominal organs. So it's just like that. Of course, there can be many other side effects, but these are the most common side effects depending on which part of the body is getting the radiation. On the other hand, the chemotherapy side effects are mostly like nausea, vomiting, some drop in blood counts, and both of these tumor treatments can have a long-term side effects also, which may not be limited to, but are can include some second cancers as well. Like many of these chemotherapy drugs, they can develop can cause leukemia. Radiation can cause a second cancer in the body after decades of initial radiations like that. But now,
that was actually
right.
Yeah. So I was going to ask you that can a side effect be a cancer itself? So thank you for answering that question.
Theoretically, yes, but the risk is, as per the Western literature, the risk is less than 1%. And again, the risk is much more when the radiation is given at a very early young age. And as the person grows, the risk gradually goes down. And typically, this cancer induced by radiation happens after a decade or more. It's not an immediate side effect.
Okay. Well, thank you for that, and I love how you put a positive spin on a critical, topic. So thank you for keeping that positivity alive. So if thank you. So if somebody is joining, we are in conversation with Dr. Dodul, and we are talking about cancer care. So are there any alternatives for cancer that don't involve radiation or chemotherapy?
Of course, yes. There are two things I would like to mention about, which are scientifically proven. One is heat. We all have heard about heat, and probably heat is one of the very, very early mechanisms by which people try to kill the cancer cells. So even before this, like thousands of years back, people tried to chop the tumor off the body because that was the easiest way to do, and then burn the tumor. Now we call that hyperthermia. Okay. So hyperthermia is scientifically proven anti-cancer treatment modality. Of course, it does not work very well, but for certain tumors in a properly designed centers having the necessary equipment and manpower, hyperthermia can be utilized in some tumors, of course, in not all tumors. There are some studies to suggest that in sarcomas, few sarcomas, of course, not all sarcomas, hyperthermia, when coupled with radiation and then surgery, can give better result. Okay. The other one I'd like to mention about is one tumor treating film, some kind of electric stimulation done to the brain, and that has been used in treating one of the deadliest cancer known as glioblastoma or GBM. And again, there is a very good study to suggest that when you add this TTF, which is not radiation, which is not chemotherapy, which is not surgery, it's just a device someone needs to wear on their scalp, that actually helps increasing the survival. Right? Of course, it's along with the standard treatment of surgery, radiation, chemotherapy. So hyperthermia and TTF are two other alternative treatments which can have significant impact on the outcome in properly chosen patients. It's not like recommended for each and every one. The other, which are not scientifically proven, and we do not want to discuss much are the alternative medicines. Now, many of our people, they actually start their treatment with alternative medicine, like homeopathy, Ayurveda. Now, we really do not know whether there is any scientific data to support the use of all these medicines. People do claim that yes, I have seen someone getting completely cured, but hardly I have never come across any properly scientifically designed randomized controlled trial where these type of alternative treatments have shown any benefit. So I have definitely my reservation in recommending these treatments.
Okay, perfect. That is actually a perfect segue into the next question I'm going to ask, and you briefly touched upon it. What is the role of cancer vaccine?
Oh yeah, great. It's a great question. So cancer vaccines, I would say we can again divide it into two ways. One, to prevent the cancer. And that I have already told that cervical cancer and some liver cancers can be prevented by proper vaccination at proper time. Cervical cancer vaccination program is recommended in many developed countries now in school-going girl. In many countries, they actually give this vaccine to boys as well to prevent some anal cancer or anogenital warts. So the typical age is between 9 to 26 years of age, or we say before first sexual intercourse, when the person has not been exposed to sexual relationship. Particularly, that is the time when the vaccination gives best of the result. Cervical cancer vaccines still can be given up to the age of 45. However, the benefit in this age group means beyond 26 and below 45, the quantum of benefit in terms of risk of reduction gradually goes down. So one can definitely opt for it, but the benefit may not be that much great. So ideal age is 9 to 26. And of course, this hepatitis B vaccine can be taken at any age. The other is vaccine used for treatment. Now, many of us probably do not know that much about this. We have heard about BCG vaccination, which is used for tuberculosis. Now, the BCG vaccine can also be used as treatment purpose for very, very early bladder cancer, urinary bladder cancer. So superficial urinary bladder cancer, after removing the tumor, BCG is recommended to prevent future risk of recurrence. Now, of course, the formulation is completely different than the ones used for tuberculosis vaccination. So one should not get confused that is the same vaccine which we give in the skin can be used for urinary bladder. So the formulation is different, the way of administration is different, and it is done under the supervision of an urologist who are expert in this. The second one I'll be discussing about is a specific vaccine which is used in prostate cancer, Sipuleucel T. So it's one of the vaccine which can be utilized for treatment of prostate cancer patients.
Okay, wonderful. Thank you for sharing that information. So at least there is some vaccine, and under supervision and guidance, you could receive that vaccine. So, nowadays they always say, oh, we have something, we've heard this, let's go for a second opinion. It's very common. So then my question is based on that what is it really important, or how important it is to get a second medical opinion for oncology diagnosis?
Yeah, it's very, very important to have a second opinion. It all depends. Let me put forward my own perspective and thoughts. I always believe outcome of cancer patients mostly decided by the single fact that who is the first contact person or first contact physician. Now, there are many centers who are treating cancer patients, giving opinions. Most of them are probably correct, many of them may not be correct. So a person can have a second opinion from a proper center or from a proper oncologist who are expert in that particular field. So good centers, they have something known as tumor board, which actually works like a second opinion only. So you have a tumor board where many experts, they sit together, they discuss the sense of this cancer, but then there are probably 10 other studies which say that no, this does not cause cancer. So that's an area of confusion. It's always best to have a balanced diet. Have everything in recommended dose and amount so that you are not getting exposed to something probably which can cause cancer in a high dose. So you are reducing the concentration and amount of cancer. Of course, you should not become paranoid. We should take help from the experts. We should not ignore anything. And we should go to a proper place having all the modern facilities, amenities, and a group of doctors taking care of cancer patients together, where things are done in a streamlined manner, so that our ultimate goal of providing cure can be achieved, and the patients can get cured without much problems. So make follow a healthy life, spend some time on a healthy lifestyle, eat healthy food, avoid junk foods, do exercises, and of course, get screened if you are a believer of screening and if you're willing to get screened at proper age under proper medical guidance. That's it.
Thank you so much. And, it's always our pleasure. The sessions with you are always informative. I know I have learned a lot, and I'm sure our viewers have also gained.
It's a pleasure being in this program, and I must appreciate your efforts and the questions you asked. They are all very, very relevant and interesting. Thank you so much.
Thank you. So with that, this is RJ Kunjan signing off. Sayonara till we meet again. Stay tuned, stay safe, and keep smiling always. Namaskar.